In this presentation, we'll be taking a quick look at something called benign paroxysmal positional vertigo, also known as BPPV. We'll be having a look at some of its causes and also some of its treatments. But before we get into all that, let's have a little bit of a chat about what BPPV actually is. BPPV is the most common vestibular disorder, accounting for about 20% of all cases of dizziness. And if you look specifically at the older population, you can see that it accounts for about 50% of all cases of dizziness. So you can certainly see that it increases in prevalence as you get older. In terms of actually describing what BPPV is, we can have a look at the name itself, as each of the words in the name describes a particular part of BPPV. So firstly, it is benign, which means that it's not particularly life-threatening or serious in any way. It is paroxysmal, which means that it occurs suddenly and often leaves just as suddenly. It is positional, which means that it occurs in response to a head rotation, and it is vertigo, so it is the experience of a spinning sensation. So what are some of the signs and symptoms that are associated with BPPV? The most common symptom reported would be that of episodes of dizziness, and as I mentioned earlier, these would be in response to a change in the position of the head. So for example, if you're rolling out of bed in the morning, or if you're looking up at the top shelf of a grocery store, those are situations in which that dizziness can actually be triggered. Another symptom is lightheadedness, general instability or unsteadiness. Another major one is also nausea and sometimes vomiting, which occurs as a result of the vertigo itself and that spinning sensation. Now, a sign that the person themselves that is going through that dizziness wouldn't actually register, but you could see if you looked at them, would be uncontrollable eye movements that we call nystagmus. But we will go into that in a little bit further on. So what is going on and what is causing this BPPV? When we look at the ear, we tend to separate it into three main parts. That is the outer, the middle, and the inner ear. When we're referring to BPPV, we generally tend to refer to the inner ear, but more specifically than that, we refer to the vestibular part of the inner ear. This vestibular system is made up of 5 distinct sensory organs, which can sort of be separated into 2 main parts. So firstly, we have the 3 semicircular canals, which are sensitive to what we call angular motion. So that is looking up and down, looking side to side, and also tilting your head from one side to another. And we tend to call these based on the position that they lie in. So we have the anterior, the posterior, and lateral canal. Now the other 2 organs of the vestibular system are known as otolith organs, and their names are the utricle and the saccule. Now both of these otolith organs are responsible for what we call linear acceleration, so that is movement in the horizontal plane and the vertical plane. Now both of these otolith organs contain calcium carbonate crystals, which are referred to as otoconia. Now what happens in BPPV is that the crystals may become dislodged from the utricle and may actually fall and become trapped into the semicircular canals. Now it's most common that the posterior semicircular canal is the one that is affected, and that's purely because of its positioning, and it's the easiest canal for the crystals to fall into. Once there are crystals in the canal and a head movement is made, for example, you look up, the crystals that are situated within the canal will drop as a result of gravity, which means that they abnormally stimulate the canal. What this then does is it sends a message to the brain, and it tells your brain that your head is moving in a direction that it actually isn't. Now what the brain tries to do is to compensate by moving your eyes in the opposite direction to keep whatever you're trying to look at steady, which is a totally normal response. The catch here is that your head isn't actually moving, so the response of your brain and your eyes to move in the opposite direction is actually inappropriate. And this eye movement doesn't just occur once, it occurs a number of times, and it looks like what we call a ticking motion, so it's constantly ticking, and that's what we refer to as the nystagmus that I spoke about earlier. And it's this nystagmus that causes the vertigo and the spinning sensation, because when your eyes are constantly ticking, your brain interprets that as a spinning sensation. So now we know how it's caused, then how is it actually diagnosed? So how do we know if someone actually has BPPV? Well, the most common test is known as the Dix-Hallpike test, and that's specifically for the posterior canal BPPV, because as I mentioned earlier, that's the most common form of BPPV. So what this test is a series of motions to actually trigger BPPV in a person. So it's coming from an upright position, laying back and looking to one side, and then repeating that on the other side. And you're actually watching for that nystagmus that will occur if that person has BPPV in the posterior canal. If you're looking for BPPV in another canal, you can use VNG or ENG testing to monitor the eye movements and look for nystagmus as you put the head into different positions. So now that we've talked a little bit about how it occurs and how we diagnose it, the question still remains, how do we treat it and how do you get rid of it? So when left untreated, BPPV tends to go after a couple of weeks of its own volitions. However, treatments are available, so you don't just have to sit back and wait for it to go. The most common treatment is what is known as the Epley maneuver, but again, this is for the posterior canal BPPV, so it won't be useful if you have a BPPV that is caused as a result of crystals in any of the other canals. Now, the maneuver is a series of steps that aims to dislodge the crystals from the canal by guiding the patient's head through a series of rotations that allows the crystals to actually escape from the canal. You can see those steps on the diagram here. Now, once the crystals are displaced from the canals, the attack should subside, although sometimes it does take multiple attempts to actually dislodge all of the crystals. It is worth noting also that new crystals can fall into the canals again, which can trigger BPPV again. If this does occur, you just simply do the maneuver again to rid yourself of those symptoms. Now, other treatments are available, such as the deep head hang and the Lempert roll maneuver, which do treat anterior canal BPPV and lateral canal BPPV respectively. So like the Epley maneuver, they won't be useful for any other kind of BPPV. If you are experiencing BPPV, I would definitely recommend going to your doctor and having them refer you to someone who is able to help you with that diagnosis and that treatment, as those are the steps that you would want to be taking in order to alleviate yourself of those symptoms. So I hope you found this video educational and informative, and thank you for watching.